Hi, good day everyone. My name is Mylene Romero, and as assigned by our Director of Nursing, I'm going to deliver a lecture regarding routes of drug administration as part of your orientation as newly hired nurses. So, um, we have the objectives. Number one is to identify the 10 rights of drug administration. List the different routes of medication administration. Understand the importance of each route of medication administration. Identify the advantages and disadvantages of each routes of administration. And develop critical knowledge regarding medication administration. So before we dive into the topic, let me discuss very important factors before drug administration. These factors are formulated to ensure the safetiness of our patient. So we have here the 10 rights of drug administration. Number one, right patient. So we should always be sure that we are giving the medication to the right patient. How are we going to do that? By using two identifiers. If the patient is conscious, we can ask the name of the patient. And if not, we can use the wristband of the patient. Okay, number two is right medication. We should always check the doctor's order. And brand names should be avoided in order to avoid confusion. Okay, number three, it is right dose. So this one we can check with the doctor's order also in order to make sure that we're giving the right dose. Number four, right route. We should always check that we are giving it to the right route, and we should always be we should always assess if the route is appropriate with the patient, because sometimes the order of the doctor is oral medication, but when you check the patient is unconscious, or the patient kept on vomiting, or the patient cannot tolerate oral medication, which put him or her high risk of aspiration. So with that, we can always consult to the doctor that the patient cannot tolerate this route. Then we can shift to another route. Okay, number five is right time. So this one, we should check the order of the doctor. Some medications are there's timing every 8 hours, every 12 hours, like that. So we should always check when was the last dose was given. Number six, right patient education. So with drug administration, it's very important that before giving it, we should educate the patient. We should educate that this drug is for headache. This drug is for constipation. This drug is for like this. Okay. So number seven is right documentation. So ideally, after giving the medication, we should always sign it. Immediately after giving the medication, we should sign the MAR that we already gave the medication. I know sometimes we are busy, but ideally it should be like that. Okay. So number eight is right to refuse. So all patients, especially if the patient is oriented, we should always ask the consent before giving the medication. Okay. Number nine is right assessment. So, before giving the medication, we should always assess the patient, the need of the medication. For example, you are giving a laxative medication to a patient who has constipation. But upon assessing that day, you notice that the patient already passed 3 times. So, what to do? Of course, we are not going to give the medication. We should hold the medication and then inform the doctor. Okay? And then number 10 is right evaluation. So after giving the medication, we should always assess for the effectivity of the medication. If we've given a drug for a medication for headache, then ideally the headache should subside. So if not, then we can resort to another medication, stronger one. Okay? And we have here the classification of different routes of drug administration. So we have the systemic and local. So for systemic, we have enteral, and under enteral, we have oral, sublingual, and rectal. We have another under systemic, parenteral injections. Number one is intravenous. Number 2 is intramuscular. Number 3 subcutaneous. Number 4 intrathecal. Number 5 intradermal. And number 6 intraosseous. Under systemic also, we have the transdermal and inhalational. And under classification, we have local, which includes skin, topical, intranasal, ocular drops, mucosal, throat, vagina, mouth, and ear. Okay. Before giving the medication, there are a lot of factors governing the choice of route. First is physical and chemical properties of the drug. Might it be solid, liquid, gas, solubility, stability, pH, and irritancy. Site of desired action, localized and approachable or generalized and non-approachable. So for the rate and extent of absorption from various routes. Effect of digestive juices and first pass effect. Rapidity of the desired response, emergency or routine. Accuracy of dosage, condition of the patient. Maybe the patient is conscious, unconscious, or vomiting. So yeah, we have here route of administration and their onset of action. So we have the intravenous, which is 30 to 60 seconds, intraosseous, 30 to 60 seconds also, intramuscular, 10 to 20 minutes, subcutaneous, 15 to 30 minutes, inhalation, 2 to 3 minutes, oral, 30 to 90 minutes, and transdermal, uh, which is topical. The onset is variable depending on the medication that you are giving. Okay. So under enteral route, we have the oral. This is the most common route of drug administration. Drug is given by just through oral cavity. So the advantages are it is convenient, it is safe, it is self-administered, economical compared to other parenteral routes, usually good absorption, and no need for sterilization. Disadvantages includes slow absorption, slow action also, irritable and unpalatable, cannot be used with uncooperative, vomiting, and unconscious patient because of the risk of aspiration. So dosage form of oral medications includes capsules, powders, tablets, sponsules, syrup, emulsion, suspension, and elixirs. Uh, Under enteral route, we also have the sublingual buccal route. This route facilitates rapid absorption into the drug into the systemic circulation. Drug directly reaches the systemic circulation using blood vessels because our mouth, especially the sublingual and oral, are rich in blood vessels. Okay, so advantages: drug absorption is quick termination, first pass avoided, can be self-administered, and economical. Disadvantages are unpalatable, bitter, irritation of oral mucosa, and then large quantities cannot be given. Okay. So under enteral route, we have again rectal. Drugs are administered rectally as a suppository. In this form, drug is mixed with the waxy substance that dissolves, liquefies after it is inserted into the rectum. So, my colleagues, we should always remember that giving rectal medications, we should always use lubricant. So, to avoid irritant into the rectal mucosa. Okay. Advantages, it is usually used in children, little, little or no fast effect, used in vomiting or unconscious patient, higher concentrations rapidly achieved, and disadvantages, it is very inconvenient, irritation or inflammation of the rectal mucosa can occur. Okay. So for the parenteral routes, we have, this is the direct delivery of drug into the circulation without intestinal mucosa. So we have here the intravenous, intramuscular, subcutaneous, intrathecal, intradermal, and intraosseous. Parenteral routes still, the disadvantages, it is high bioavailability, no first pass metabolism, rapid action, suitable for vomiting, unconscious, no gastric irritation, no food-drug interaction. Dosage form includes vial or ampule. And disadvantages, there is a risk of infection. So we should always observe aseptic procedure. It is invasive, assistance is required, it is usually painful, and need the skilled nurse to do it or a skilled healthcare provider. Anaphylaxis, and it is expensive. So under parenteral route, we have the intravenous. It is used primarily where a rapid onset of action is required. Example for anesthesia, emergency medication, or because if the patient is persistently vomiting or is unconscious. So we can do intravenous route. Okay. Advantages includes precise control of dose and administration rate, rapid exposure. For emergency, large quantities can be given and it's barely painless or there's no pain in it, and 100% bioavailability. So the therapeutic effect of drug can be achieved 100% because it surpass the first pass metabolism. So disadvantages, however, unlike any other drugs in the GI tract, those that are injected cannot be recalled by strategies such as emesis or by binding to activated charcoal. So there's also a risk of infection. As I said, we should always observe a septic procedure. IV injection may also induce hemolysis or cause other adverse reaction by the too rapid delivery of high concentrated medications to the plasma and tissues. So we have IV medications, for example, potassium. Potassium should always be diluted and should always be given slowly to avoid adverse reactions. So we should always be careful regarding the medications that we are giving to the patient. Okay. So thrombophlebitis of vein are necrosis of adjoining tissue if extravasation occurs. So we should always, if we have the IV line, we should always check if it is already infiltrated, extravasated, or there's a phlebitis. So with those scenarios, we can remove it and we can reinsert another IV line. Okay, and then also need some patients, especially those patients who are hypotensive or emergency cases, those are patients who are in code blue. Sometimes needle insertion is very difficult. Okay, those are the disadvantages of intravenous route. Next is intramuscular. We have the route or the area of intramuscular route, which includes deltoid, tricep, gluteus maximus, and rectus femoris. So advantages, absorption is reasonably uniform. First pass avoided, gastric factors can be avoided also. Disadvantages, only up to 10 ml of drug can be given. So there's also be local pain, infection, nerve damage, and abscess can be developed if given to the wrong site. So we should make sure that we are giving the intramuscular injection into the correct site. Okay? So like local hematoma can occur also in anticoagulant treated patient. Under parenteral route, we still have subcutaneous. Drug is injected into the subcutaneous tissue, which has nerve supply but less vascular supply. So advantages can be easily self-administered by the patient, decreased cost, this painful route, low risk of systemic infection, and large number of injection sites for multiple dosing. So with this, we have like the enoxaparin injections and insulin injection. So with this, we should rotate the area, especially with the multi-dosing, um, in order to avoid the lipodystrophy, okay, in the area. So disadvantages, volume limitations is up to 1 to 2 ml. Degradation of therapeutic injection site. So this is lipodystrophy is one of it. Retention at injection site can lead to local adverse reaction also. Number 4, intrathecal injection of drug into the subarachnoid space into the cerebral fluid. This route can be used as method for direct delivery of a drug into the central nervous system, for example, spinal anesthesia and antibiotics in cases of meningitis. So advantages are drugs act directly into the meninges, and CNS. It bypass the blood-brain barrier and CSF. Disadvantages requires expertise. Infection must maintain aseptic procedure and painful procedure. So as I said, not all nurses can give intrathecal route. Okay, because this is, it requires skill and it should always be aseptic to avoid infection. Okay, so number 5 is intradermal. Commonly, this is used for tuberculin skin testing, but can also be used for allergy testing, especially for antibiotic testing, iron testing if you have allergy, and local anesthetics. So advantages is low absorption and is appropriate for testing drug allergies. Disadvantages can only accommodate a small amount of drugs. Okay. So number 6 is intraosseous. It is injected directly into the bone marrow. Advantages: easy access, can infuse all types of medication and fluid, easily done in a CPR or cold blue scenario. So this intraosseous, we can give this as emergency if we cannot find any arterial access, uh, vein access to patients who are in code blue. So intraosseous is a very good route to give medications. Okay, disadvantages: it is painful, temporary access only, should be left in no longer than 24 hours. Okay. We have also the transdermal route. This route of administration achieves systemic effect by application of drugs into the skin, usually via transdermal medicated adhesive patch. The rate of absorption can vary depending on the physical characteristic of the drugs and skin at the site of application. It has a slow effect, prolonged drug action. This route is most often used for the sustained delivery of drugs such as anti-anginal drug nitroglycerin and anti-emetic scopolamine and nicotine patches. So fentanyl patches also, it has like 3 days. So this is given also via transdermal route. So site is upper arm, chest, abdomen, mastoid region. Okay, and another is inhalation route. Mucous membrane of the respiratory system. This route is particularly effective and convenient for patients with respiratory complaints such as asthma, chronic obstructive pulmonary disease or COPD, because the drug is delivered directly into the site of action and systemic side effects are minimized. So advantages, we have the rapid absorption, provide local action, minor systemic effect, low bioavailability, less side effect, no first pass effect. And disadvantages includes only few drugs can be administered, not suitable for irritant drugs. So we can deliver this via nebulization or atomizer. So these are the example. So we have also under local in topical application. The drugs applied to skin, mucous membrane for local actions. A few examples are as follows. So skin, we have allergy testing, topical local anesthesia. Mucous membrane of respiratory tract inhalation, example nebulization in asthma cases. So we can eye drops also in conjunctivitis, eardrops in otitis externa, and intranasal in nasal congestion. So so thank you for listening, and I hope it will help you as you start your career in our hospital. Good luck and God bless to all of you. Thank you.